So for my final project, I chose to discuss a passage in part three, the spirit of agency. The passage that I choose to focus on is called "Calm Down, Relax. It isn't that big of a deal," which the author focuses on her experience in regards to mental illness and mental health. Just quickly on the passage, it seemed to me that what she was explaining is that, because her siblings had all these health issues, her family saw her as like the golden child. There's nothing wrong with her. She's completely healthy. But really, in reality, even though she wasn't physically sick, she was mentally dealing with something, which is a big thing about what mental health is. It's not as all culture, the minority community see it as. They see it as mostly something hereditary or something that's passed down, but really just being human and living day to day and daily life experience, you can experience some form of mental health, whether it's anxiety, depression, PTSD, ADHD, just being overwhelmed with certain things and just not knowing how to cope. Just the imbalancement of the brain can cause mental illness. So with that being said, with my line of work, I'm in the military. I have like a lot of soldiers who deal with PTSD, especially when they come from overseas. I've known quite a bit of them who's taken their lives. That's very common, unfortunately. Young soldiers who barely 20, 21, and we just go through the training of just recognizing the signs and just simply asking the person, are they okay? Those little things is what is the first step into like getting to the root of the problem and just talking to someone and just finding out, hey, what's going on with your family, what are you dealing with, and everything. And for this course, since we're talking about being teachers, future educators, I strongly believe that, without the training, you won't know. You can't be empowered unless you have the knowledge. So with my job, with the line of work I'm in, we empower ourselves because we are constantly training on mental illness and how to recognize common signs. And that's the same for teachers. I strongly believe that they should have some form of training and education in mental illness on how to recognize the common signs of mental illness. Implement programs into the schools. One program that could easily be implemented in school, which I think would be extremely beneficial for students, is the it's called the Kids Teen and Control Program, which is offered to children from ages 8 to 18, where they can find guidance and support, but most of all, they meet and speak with others their age who share similar day-to-day experience. Learning from their peers. I think that's the most really effective program for students. That should be implemented in the school. And my son's school has that because he also experienced his own fair share of that situation where he lost his friends, and he went through his own moment where that program helped him. School counselors and social workers within the schools, and teachers, they were able to get in there and get involved, and also educating the parents and getting parents involved in and giving them the necessary resources, the resources that's within their communities. There are so many there. One resource is NAMI. It's a organization called NAMI, the mental health, the National Alliance on Mental Illness, which is located within many communities throughout the United States. They are constantly working to educate, advocate, and help people improve their lives while living with mental illness. They teach people how to recognize the common signs of mental illness, and even more importantly, help people to realize how common mental illness is among everyone. Educating is important because it brings awareness. That's the biggest thing, is bringing that awareness and knowing how to cope and how to help someone else deal with it, whether it's a friend, colleague, whichever it is. And I also believe if you know more, you can grow and empower others and bring more knowledge within your environment.